But there are questions that they are content, but you really need to understand that content to answer the question. But it really gets interesting, and this is where the passing line meets the questions that are application and analysis questions. Those are the most difficult questions you will see on the NCLEX, and those style of questions are the one that is going to determine if you're able to pass the NCLEX or not. I don't know if you've ever taken the NCLEX before, and you've received the candidate report. The candidate's report, the performance report, basically tells you on the different categories, and let's say physiological integrity, psychosocial integrity, management of care. It's going to tell you if you are near, below, or above the passing standard. Well, the questions that are above the passing standard are questions that are at the application and analysis questions. What this means is that if you don't develop the ability to answer analysis and application style of questions, you will not pass the NCLEX. This is important. You can be an expert in nursing content, but if you don't answer analysis and application style of questions correct, you will not pass the NCLEX. However, do not get discouraged. That is an ability that you can learn, you can practice, and you can perfect. All right? So let's see the difference. What is the difference between a recall and recognition style of question and an analysis and application style of question? Well, basically, a recall and recognition style of question is a question where you maybe have to recall normal blood pressure values, normal heart rate values, O2 saturation values, and basically you have to choose what is the answer that meets these normal standards. That is a basic recall and recognition style of question. Like, for example, choosing a medication from a list. Very basic. Most of the students answer those questions usually very easy. The analysis and application style questions, these are higher level of cognitive ability or cognitive skills. Analysis involve breaking down complex data, understanding nursing components, understanding or interpreting critical lab values in order to apply the nursing knowledge on an NCLEX question. You need to develop critical thinking, and that is the key, once again, to passing the NCLEX. The NCLEX focuses more on analysis and application questions rather than just basic recall and recognition questions. This is why if you practice with questions that are only at the recall and recognition level, you're not using a quality question bank. You need to practice questions that are content, yes, but you also need to practice questions that are analysis and application style of questions. Let's look at the difference.